Hello. Presenting a case report is often an exciting time for a postgraduate resident. It's the time that they get to showcase their clinical acumen, their critical thinking abilities, and their ability to interpret a case completely. However, for a fresh PG resident, the case report can sometimes appear daunting, very challenging in terms of what should I do? How do I present this case? How do I go about it? What are the elements that I should not forget? My name is Dr. Praveen Narmalan. On behalf of AMMA Healthcare Research Gurukul, we would like to share with you a format that we have that can help PG residents present their cases in a comprehensive yet precise manner. The first part is the title. And oftentimes we wonder what should be placed in the title of the case. The title has to be descriptive, yet concise and precise enough, so that it conveys enough information about the case without being very lengthy. It should describe the phenomenon of greatest interest in the case, whether it's a symptom, it's a diagnostic test, the diagnosis, intervention, or outcome. What is of greatest interest in that case? If you're a radiology resident, it might be the imaging or the diagnostic test that's of greatest interest in that particular case. If you're a clinician, it might be the interventions or the outcomes. Or it could be a description of the clinical case symptomatology as it is. Title should provide a description about what happened with this particular case. Precise, concise description and a potential time frame for this particular case. Now, once we have the title out of the way, then we move on to presenting the case as it is. Now remember, the title should provide enough information for the audience to gather that you are going to be presenting something on this particular. That makes it easier for you. So how do we describe what happened? We could use a narrative text. We could use a visual display. Preferably use a visual display because it provides a lot of information in an eye-pleasing manner, concise manner that can be easily grasped by the audience. So use tables or figures. When you're presenting timelines, and start with presenting a timeline, a chronological summary of the visits of this particular case. When you're presenting timelines, try to present it as a flow chart if possible, a figure, or a table. And once you have finished that and you've shown the time flow of the particular or the timelines of this particular case, you can move on to the presenting concerns. The presenting concerns often are the chief complaints and the relevant demographic informations relevant to this particular case and with a particular focus on the chief complaints or the presenting complaints of the subject. We move on to clinical findings. We talk about relevant past medical history. The key point is relevant past medical history. Relevant. Don't just describe everything in the past. It has to be relevant to the case that you are presenting. It has to be relevant to the case that you are describing. Pertinent comorbidities. Associated comorbidities. Again, relevant to the case. Not just any comorbidity that is there, but relevant to the case. And the important physical examination findings. We then move on to the diagnostic testing. We present the results, we present what tests were done, when were they done, how were they done, what images were acquired, what tests were done, what are the results. And then you move on to a list of differential diagnosis based on the clinical history, symptomatology, the results of the diagnostic test, and then to the diagnosis. This is the usual order that we have when we present cases. We learned that during our undergraduate days, so the order does not change too much once you come to the postgraduate sector. It's only that you now add more information and more interpretative information into the mix. You then describe interventions, the types of interventions, when were they done, how were they done. Describe if they are pharmacological interventions, surgical interventions, preventive interventions, lifestyle interventions. So what type of interventions were done? And all of this has to be relevant to your case. So don't present anything that is not relevant to your case. Everything is aligned and is relevant to your particular case, to the complaints, to the history, to the physical findings, clinical examination findings, to the diagnostic test results. And then you describe about follow-up and outcomes. If there is no follow-up done, if it's been a cross-sectional study and there is no follow-up done, that you describe that there was no follow-up, that what you're presenting is what we saw at this particular cross-section of time in this particular case. Then we come to the next, the meat of the case presentation, the discussion. So the description of the case is one aspect, but the meat or the body lies in the discussion. And you need to discuss, why is this case important? What makes you want to present this case? Why do you want to present this case? You can discuss the case management. If it's a diagnostic workup, you can discuss the diagnostic workup. If there is a therapeutic or an interventional workup or strategy or happening, you can describe that. Don't just describe it. You have to mention the strengths, you have to mention the limitations, and you have to discuss the information in the context of the strengths and limitations. So if you're doing a diagnostic workup, you're going to discuss in the context of the strengths and limitations of each diagnostic test. You could bring in parameters of diagnostic test effectiveness. You should bring in parameters of diagnostic test effectiveness. What is the sensitivity? What is the specificity? What are the predictive values? What are the likelihood ratios? What are the diagnostic odds ratios? How does the test perform? And given those strengths of the test, what are the limitations of those tests? This is the way I'm interpreting this particular test result. You have to discuss what's important, what's different, what's new, what's the value addition. It's not just a replication of a case that has happened many times. So you're discussing what's different, what is new, what's the value addition. And make sure that you discuss with references, preferably recent and context-based references. So always have a list of references down there as a pointer. If you're using a PowerPoint, at the bottom, smaller font size, have a list of references for each discussion point that you're making. Show that, well, this is the context. That's important. That's an important practice to develop. That's an important habit to develop. And this is the place you can develop it. At the end, you conclude. The conclusion is a set of 3, 4, maximum 5 statements that present the most important findings from the case. You don't need to present references. You're presenting the most important findings of the case. This is a small format, a systematic format that can help you present any case without missing out on the important key points or key elements of the case. What's very important to remember is that you don't just describe the case, you discuss the case. And what has to come out in the case presentation is your ability to provide an interpretative discussion pertaining to the case that is being presented. So the description is important. More important, what has to really come out is your ability to assimilate all those findings, put them in, place them, order them, and then interpret them in an appropriate manner. So, a very short presentation that can help you with your case presentations in different forums. You can use this even in conferences. You can use this in your classroom settings. hopefully it will help you along the way. Thank you so much. We hope to see you sometime soon again. Till then, goodbye. Stay safe. Be happy.